Hey everybody, we are in week 2 of Nursing 333 Pharmacology. This is your module 2 looking at pharmacology and nursing care, and we are going to take a look at the nursing process and how it applies to pharmacology. Just as you learned in your fundamentals and the nursing diagnosis that you learned how to write and how to plan, how to assess, diagnose, we're going to use the same nursing process and apply it to medication administration. So taking a look at the nursing process, you have all your same 5 steps: the assess, diagnose, plan, implement, and evaluate. So in your first exam, you will see some questions where you have to determine what part of the nursing process you are at when you administer medications. So starting with assessment, you are taking a look at the patient's history, their physical, you are assessing their condition, what are they in the hospital for, or what are they come in to the office for, things like what age they are they pregnant, is this an elderly patient, do they have any previous conditions like kidney disease, liver disease. You're also taking a look at their medication allergies, and also taking a look at their medication reconciliation, where you are looking at what is prescribed at home and possibly what is given here in the hospital, and if something is missed or needs to be DC'd. You're also taking a look at is the patient able to swallow pills? Do they need liquid? Are they NPO? All this is part of your assessment process. So then, once the patient is assessed, you are moving on to the diagnosis. And 2 key factors when you look in the diagnosis is potential for injury, looking at the allergies, could this new medication that you're giving a patient cause harm? And also knowledge deficit is another really big nursing diagnosis in pharmacology. Is this a new medication? Does the patient need to be educated on how to take it, when to take it, and also the side effects? So that is your diagnosis part of the nursing process. When you're going into the plan, this is when you set goals. You're looking at medication knowledge that you're going to teach the patient, special needs, do they need equipment? Possibly if it's a respiratory medication, do they need an inhaler? Do they need to be taught on how to use a spacer? Whether it's a pediatric, an adult population, you're going to take all that into consideration. So this is your setting goal phase. When you're moving into the implement, remember, implement is doing something. It's an action. So looking at the questions, if it involves an action, then you're probably into your implementation phase of the nursing process. This is when a nurse administers medications. You're checking all your 6 patients' rights. You are also looking out for side effects. You are monitoring vital signs during a medication administration. Again, if it involves an action, you're probably into your implementation phase. And then your last phase is your evaluation. Did the medication have the therapeutic effect that you are looking for? Did it have an adverse reaction, something that you didn't want, or paradoxical effect? It's opposite of what you're looking for. Did they get an allergy to that medication? So this is your evaluation. Did they receive the correct medication? And did their vital signs remain within normal limits? So all that will be your evaluating, and then you will appropriately document in your evaluation phase and potential for the future. So if they did have a reaction, possibly they might have an allergy to this medication and it wouldn't be administered again. So making sure that you're looking at all the phases and you can recognize what part of the nursing process you're at when administering medication. Doing as many practice questions as possible is going to be your best way to recognize which part of the nursing process you're at.